Good afternoon. Welcome back to By Any Greens Necessary. I'm your host, Melvin Thompson. I'm the Executive Director of the Endeleo Institute. Endeleo is a member organization of Trinity United Church of Christ on the far south side of Chicago, 400 West 95th Street, in fact. This show is about generally farmers markets and our Trinity Farmers Market, which we supported as an organization this summer. I'm glad to have you back here. This past Saturday was actually our final Saturday at the market, and I'm happy to report that we went out literally with a bang. We had more than 340 people who came out and celebrated with us and bought things, and the farmers sold out, and it was just wonderful. I couldn't be more excited at the momentum that we built going into the latter part of the summer. There were a lot of people asking, well, where will you be next week? Are you going to do a winter market, and all those things? And stay tuned. We'll see. I know we're going to be doing nutrition education throughout the Washington Heights community where we work. So we just stay tuned. We're going to be, really preaching healthy food. We had so many people, so many first-time people at the farmers market, and that was even more impressive because that was one of our goals. Of course, we want people who are aware, but people who are not taking advantage of healthy food, we wanted to introduce them to the concept, and dozens of them return throughout the summer. I wanted to show you a quick picture of who all made this possible. Take a look at not me down there bending down acting silly, but those folks behind me represent the black farmers of Pembroke, Illinois. There were approximately 7 of them who came consistently every week and participated in the idea of cooperative economics, where the dollar was circulating within Washington Heights exclusively, and it was just wonderful. The gentleman in the red, I can point to him in the red. Mr. Barker has the world's greatest healthy soup. I can tell you that right now. I've got a freezer full of it right now, and so does our office. There's a young lady here, Carolyn Thomas, who actually about midway through the market unfortunately suffered a mild stroke and probably took 1 week off and then came back every single week, including the last week. So we're just excited about the dedication, about everything that went on with this market. The prescription, if you will, this summer was healthy food, and we couldn't have done it without these farmers, because last year and the previous years we had struggled to get farmers to the market because we didn't have the folks to show up. And so we had a dual challenge this summer. We had to get farmers and we had to get people, because without either, you don't get a market, because farmers won't come where folks aren't showing up. And so we were successful on both ends. It was a robust market, and we're thrilled to have it. In the course of that farmers market, however, and this is why you have to be vigilant as a community, as an organization, as residents, because while we were focused on healthy food and healthy access to it, we had, as I've said many times on this show, our Walgreens closed, and it was our second Walgreens to close in the Washington Heights community. And what I have learned in the last 2 or 3 weeks is that has now qualified Washington Heights as a pharmacy desert, unfortunately. We were already in the midst of a food desert, and now we're in what is known as a pharmacy desert, where access to medications that are sorely needed, particularly in a community like Washington Heights, where we have one of the highest if not the highest median age in the city of Chicago. We have 4 to 6 senior facilities in Washington Heights. So that should tell you the need, the dire need that's in this community for medications. And we'd love it that folks didn't need these medications, and this is why we do the farmers market, because we want to eventually wean people off the reliance of medications and having to go and have 14 bottles of pills on your desk. As a deacon of Trinity, I see this in my visits to the sick and shut in, and I just say, wow, these medications are literally keeping people going from day to day, and there's a better way to do that. And maybe if our medical field and our researchers did a better job of promoting healthy food as a supplement to the things that they're taking, that one day they may find that they don't need that kind of medicine anymore. So I was at a meeting several weeks ago with researchers and scientists, by the way, who are trying to understand better how to engage with communities around the social determinants that create health or unhealthy communities. And so they invited me, and I told them about the Walgreens that had just closed in our community. And one of the researchers, I believe from Northwestern, I believe it was Bruce Lambert from Northwestern, actually said, listen, I'm going to send you the name of someone who's done extensive research in pharmacy deserts across the country. Her name is Dima Qato. And I said, well, please send that to me. So fast forward, say hello to Dima Qato, because she is the assistant professor at UIC.
Yeah, the College of Pharmacy at UIC.
Welcome.
Thank you. Thank you for having me.
Thank you so much for being here. We've talked and we've been emailing. This is the first time that we've met in person, but just share a little bit about how you've come to even do something that most of our community, and I will tell you, most of our community had no idea that the number of Walgreens across the country had closed, and this was brought to light, of course, by ours, and upon doing a little research, we found out that this was a trend that Walgreens was engaged in. So tell me how you came to know and do this research.
Yeah, sure. So just taking a step back, one area that I initially studied was understanding differences in the use of prescription medications between different populations, including low-income, underserved populations. What we found is that wealthier individuals are more likely to use prescription medications than those that aren't so well off. And even if they get insured, there's still a gap. So many people are not using medications that they need, and insurance coverage, income, all these social factors did not explain away these differences. So one question I had, as a pharmacist, I've worked for Walgreens in Chicago, I worked for CVS, I've worked in Baltimore as well, and I asked the question, well, maybe it's because of another factor like access to pharmacies. You can't, at least in the U.S., get a prescription or a medication filled unless you go to the pharmacy, right? So that's kind of the background for this research. And we focused initially on Chicago, and what we found was that, in fact, the neighborhoods on the south side of Chicago and the west side of Chicago were more likely to be pharmacy deserts. And what does that mean? That's basically the same definition used to define food deserts.
The food desert.
We adopted the same metrics, but we replaced kind of healthy food stores with pharmacies. And we found that most communities on the south sides and the west sides of Chicago lack pharmacies. And the question now remains is, does that lack of pharmacies impact medication use or access to medications? And that's kind of the next steps, is to really understand what the implications are for all these pharmacies that are closing or not even opening in the first place.
Sure. And is there specificity in the communities that the Walgreens are choosing? Is this strategic? Why is this happening on the south and west sides and elsewhere? And I probably already know the answer to that question, but I'm going to ask it anyway.
Right. No, that's a good question, and that's something we're still trying to better understand. But it may be due to a variety of reasons. There's just no market for Walgreens there in terms of reimbursement for prescription medications. For example, communities that have more publicly insured or Medicaid, Medicare patients, the reimbursement rates pharmacies get from these insurance, from Medicare and Medicaid, are much less than private insurance plans for the most part. So for Walgreens, they think about profit. It's a business. It's not a philanthropy. So it could be. I don't know. I mean, these are questions that we're just kind of getting our hands on, but that could be part of the reason why. I mean, it's kind of interesting that after Obamacare or Medicaid expansion and all these, that so many pharmacies are closing, right?
And do you think that is a response to Obamacare, because they put these stores there in the first place before Obamacare, and now it looks like they're retreating because something maybe from a policy standpoint occurred that affected their bottom line.
It could be indirectly. I mean, there was a study that actually looked at what happened to pharmacies in rural and urban communities after Medicare Part D, which is the prescription drug benefit for Medicare beneficiaries or the elderly in the U.S. And they found, indeed, after Medicare Part D was implemented in 2006, you saw more pharmacies close. And one hypothesis or explanation for that is, reimbursement. They're not, the profit margin for pharmacies are not as high as they would like.
Well, let me say this. On the actual store closing at Walgreens, there's a sign on the door that instructs people who have prescriptions there to go to the 95th and Ashland's Walgreens in Beverly, which is next door to Washington Heights, but a world away in terms of economic opportunity, unemployment, you name it. And so it kind of dovetails with what you said in terms of, Walgreens going to communities where the profit from private insurance may be more prevalent.
Right. And I mean, that's a good, so Beverly is not a pharmacy desert. And it's a more diverse community. It may have more privately insured residents. That could explain it. We don't know for certain, but it kind of, you just said it, right? Like, why the pharmacy there's people using the pharmacy, it has a lot of traffic, but it closed. So it's kind of difficult to understand why a pharmacy that's serving an older population is just kind of suddenly gives 2 weeks notice and tells people, hey, get your prescriptions elsewhere. We're closing now. And that's acceptable. And
that's right. And in the age of, social responsible companies, that, they would do something like this and virtually it go unnoticed. And we were talking in the green room about, you were asking me, was there, outrage? Was there community, that came out? And I will say, I think there were conversations in households about it.
Kitchen conversations.
Kitchen conversations. But for the most part, it's just gone basically unnoticed, and people are basically numb. And I dare say that they're probably doing what the instruction was to, go out of your community and patronize a store outside of your community if you want your medications. And I just find that appalling and unacceptable.
Right. They're expected to kind of accommodate the pharmacy closure.
Yes, exactly.
By traveling further than other communities or residents in other communities have to in order to fill.
Which is the food desert situation. If you want groceries, then you'll have to travel 2 miles out of the community. I'm sorry, we've got a caller. You got a question or comment?
Yes, I would ask again. We have spoke before what used to be and what it is now. At one time, you used to have the little Pop Malls and Pop's little drugstores. You could go up there, you purchase little things, you could get your prescriptions and things like that. Then all of a sudden you came to Walgreens and the Oscos, CVS and whatnot. It seems like it'd be a good time now to open up these little drugstores as they used to have, Saperstein's and different pharmacies. But why they don't have that? They open up liquor stores.
That's right. That's right. That's right.
Gas stations and everything else. Why don't we have our own pharmacies where we could take our prescriptions too? Let me get out there. Thank you for taking the call. It's just a suggestion and a thought from then to now. Let me get out there so I can give you a response. And thanks for taking the call.
Thank you so much. That was a brilliant question. Were you in our green room? Because we were just talking about the prospect of communities actually doing their own pharmacy stores. And I asked Dima, actually she told me, and what was that you said about what's necessary to open one? You don't...
Right, yeah. Pharmacies, community pharmacies that serve the public are businesses. So you don't have to be a pharmacist to open a pharmacy. You have to have a pharmacist on the license, but anyone could open. It's a business, right? So, I think these are all good ideas, and we should kind of work together.
Absolutely.
To kind of overcome.
Absolutely. And to the caller's point, we did a survey earlier during the summer about would residents in the community be in favor, because we're in a food desert, would they be in favor of a black-owned co-op grocery store in place of the Walgreens that left? And we got over 700 responses, and 99.9% of them said emphatically yes, that they would support that. And so why couldn't we have, a co-op grocery store with a pharmacy located inside?
Right.
Yeah,
right.
yeah. So
there's no reason not to have that, and it's probably something that is necessary.
Absolutely. So it's something, again, and what's funny, and one of the things I shared with Dima was that the Walgreens is directly diagonally across the street from the library project that we're working on, which is actually taking place right now. We saw Saturday when our market closed, I took a ride down and saw a lot of hard hats and a lot of dumpsters and a lot of things going on. And so we were able to show the illustrative power of when communities come together and take people to task for things that are wrong in their community with the library. I mean, we approached the library over 2 years ago, and we just said, this is deplorable, this is unacceptable, we're paying our taxes, this library should be in better shape. And fast forward 2 years, we've gotten that. So why can't we go across the street and see another issue in our community and come together and do something about it? We always talk about small businesses and entrepreneurship. This is a perfect way to come in and solve a problem, because small businesses is just about, solving a problem. And obviously now, I think the residents in the community would rally around not having to travel, long distances out of the community to shop for, their medications. And at the same time, you'd have access to healthy foods in the same space. So, we can reinvent, or, that's the wonderful thing about real estate, is that, it has, you can change it to its highest and best use. And we see that corner will be catalytic, because once the library is finished next year, we think that with the 25,000 people who are, coming through the turnstiles of that library, that it will spark more development along 95th Street, along Halstead, and we'll see opportunities. And so why shouldn't we be at the forefront of those opportunities? Because as a community, we already took an anchor institution and we're repurposing it, and it's going to be wonderful. So tell me a little bit about the work that you did in Baltimore, because I was fascinated about what actually happened during the unrest that happened not too long ago.
Right, yeah. So I just wrote about kind of the response of the retail pharmacies during kind of the protests that were going on in Baltimore late last year.
And was that around Freddie Gray?
Right, yeah.
Yeah,
after,
around the murder
right,
of Freddie Gray.
Right. After that, his murder, almost more than 30 retail pharmacies closed.
Mm-hmm.
And, it was all over the news. A lot of these older patients living in Baltimore were frustrated because they couldn't get their medications.
Yeah. Mm-hmm.
And that's a problem. And it's not a problem older patients should be facing.
Mm-hmm.
And the Baltimore city officials responded by kind of providing a number where people could call and they can help them get to another pharmacy to fill their prescription medications. But I think that's beyond the point.
Yeah, that's
pharmacies
ridiculous.
Could just close and open and close wherever they please, whenever they please, wherever they please. I mean, that's a problem.
Yes.
And we see it happening here. I mean, and it's not in Baltimore. It was like an emergency situation, but it happens across many neighborhoods in the country, the vast majority of which are black neighborhoods or Hispanic neighborhoods or immigrant communities, and it's not an emergency, it's a problem. It's a problem that affects everyone every day, and we wonder then why they don't use their medications.
Yes.
And we think insurance is the solution. And hey, you're insured now, but why are you still non-adherent? You must not know the importance of taking your medications.
Absolutely.
Let me educate you because you didn't listen.
Absolutely.
And we keep on educating, but people are still non-adherent. Well, you know what? Maybe it's because it's very difficult, like the residents of Washington Heights could kind of confirm, to get their medications when their pharmacies are closing left and right.
And if there's no one in the household that can travel, a grandson or a son or something like that, or the person lives alone, who's going to do that? Who's going to perform that? That service for them, and that's not taken into account. And what's really appalling is that there isn't. There aren't town hall meetings or anything to suggest, okay, well, if you're going to do this, what is the alternative? How will we continue to have the access that we had with you leaving? And no, they just make a decision. And I think at the highest levels of policy that our public officials should be holding them accountable. Exactly. That if they pull in and have the benefit of enjoying our business for a set amount of years until the profits dry up, and then all of a sudden now we've got to go where the profits are. Sorry,
we don't care about you. Yeah.
We don't care about you. It's ridiculous.
And it's a pharmacy, right?
Yeah.
And in other parts of the world, pharmacies are part of the primary healthcare delivery model. In the United States, they're not, and I think that's the larger problem, that we need to kind of increase awareness about the important role pharmacies play in our communities. And while sometimes we need a pharmacy to close for us to realize how important they are, not just only for our prescription medications or over-the-counter drugs, but for everything else.
Sure. I'm going to show you, this is a picture of the Walgreens at 95th and Ashland. This is the store that they have directed us to go to, and you can't see it as well. I don't know if I can get better with this, but no. It says there, Advocate Clinic. So Advocate has now partnered with Walgreens and has set up a clinic inside of the Walgreens. Well, that's wonderful. That's absolutely wonderful to have, some of the acute things that happen to residents, but now they're gone. They're not in the community.
Yeah.
So,
I'm glad you brought this up, because someone else actually did research that showed that this just reinforcing the idea that, unfortunately, pharmacies in the U.S. Do not have the healthcare needs of the population in mind, because they found that these retail clinics, which you would think should be in communities that lack access to primary care, are actually more likely to be located in communities that have access to care. So it just seems like a contradiction.
Yes,
right?
yes. And that is a metaphor for our community, just an existing contradiction. And so it's unfortunate. As an organization, Endeleo is working to correct those things. I thank you so much for coming in, Dima. We're going to be working together throughout the next year. We're going to engage the community. We want to just thank you all for watching. This is the season finale of our show. We'll be back next year, but stay tuned. Go to our website, EndeleoInstitute.org. Follow us. Continue to support us. We thank you. We'll see you next year. And by any means necessary, we will improve our communities. Thank you very much.